We are going to start the symposium with our keynote, which is integrating wellness into everyday life. With that, I'm going to introduce Dr. Courtnay Caufield. Dr. Caufield currently serves as the System Associate Chief Nurse for Cottage Health in Santa Barbara, California. A dedicated nurse executive and informaticist with extensive experience leading teams in some of the nation's top healthcare systems. Courtnay has a strong record of driving innovation and improving patient outcomes. After spending 15 years in the Pacific Northwest, she joined the Southern California leadership team at Cedars-Sinai Health Systems in Los Angeles. Courtnay has served as Chief Nurse Executive at Kaiser Permanente in Portland, Oregon, and as Chief Nursing Officer at Providence Health St. Joseph. She later returned to Cedars-Sinai at Marina Del Rey Hospital campus as CNO, where she focused on revamping shared governance, enhancing clinical informatics, and contributing to the development of new hospital of the future. Now at Cottage Health, Dr. Caufield continues her commitment to improving patient experience and fostering a culture of excellence. She is passionate about mentoring emerging nursing leaders, wellness efforts, clinical informatics, including leveraging innovative approaches and advancing the profession of nursing through strategic leadership and collaboration. Most importantly, Courtnay is a strong advocate for patient and family-centered care and the support of our clinician through advocacy and mentorship. Dr. Robin Geiger is a board-certified nurse executive with over 20 years of clinical leadership experience, leading national project teams and creating programs in federal, corporate, and academic settings. She is the Chief Nursing Officer for Ingenovis Health, where she also leads the ACT, Advocacy, Career, and Tools program focused on clinician support and well-being. She obtained her doctorate in nursing practice from Touro University, her master's of science in nursing from the University of South Alabama, and her bachelor of science in nursing from the University of Central Florida. She is board certified as a nurse executive advanced and family nurse practitioner and maintains clinical privileges as co-founder and owner of a concierge-based telehealth practice. Dr. Geiger holds several board positions. She serves as the chair of the Chief Nurse Advisory Board for Ingenovis Health, a board member of National Diversity Council, and is on the American College of Education Nurse Advisory Board. She is often sought after as a global motivational speaker and lecturer on nurse leadership, mentorship, and nurse education. She holds the Clinician Voice podcast and ACT for Health Professionals webinar series. Dr. Geiger has served as Associate Dean of Academic Affairs for National University, Vice President of Clinical Services, Chief Privacy Officer from the Muscular Dystrophy Association, and Head Nurse for Veterans Affairs Community Care. She has published and presented on multiple healthcare topics and is passionate about clinician advocacy, health equity, and mentorship. Dr. Sharon Pappas is the Chief Nurse Executive for Emory Healthcare. She is a member of Emory Healthcare and the Woodruff Health Science Center senior leadership teams, is responsible for nurse practice across Emory hospitals, ambulatory care, and post-acute agencies. With 5 Emory Healthcare organizations designated as magnet, she works to establish the same nursing excellence as a distinctive competency throughout Emory Healthcare. Dr. Pappas has completed her PhD at the University of Colorado Denver College of Nursing with research focus on clinical and financial outcomes that are sensitive to nursing. She holds a Master's of Science in Nursing Administration from Georgia College School of Nursing and a Bachelor of Science in Nursing from the School of Nursing Medical College at Georgia. Dr. Pappas has authored numerous articles for peer-reviewed journals and done numerous conference presentations throughout her career, focusing on the role of nurses and the nursing environment, which play in patient safety and hospital costs. She also serves as a professor for the Nell Hodgson's Woodruff School of Nursing. Dr. Pappas is a member of Sigma Theta Chi International, the American Nurses Association, and the American Organization for the Nursing Leadership, where she served as a board member and represented AOLN on the Commission on Magnet for the American Nurses Credentialing Center, serving as chair both in 2023 and 24. Sharon received her Lifetime Achievement Award from AOLN, is a fellow of the American Academy of Nursing, where she is past chair of the expert panel on building health systems and excellence. Dr. Pappas has served on the National Academy of Science, Engineering, and Medicine committees on systems approaches to improving patient care by supporting clinician wellness. And Dr. Kavitha Reedy is currently the Associate Director of Employee Whole Health in the VHA Office of Patient-Centered Care and Cultural Transformation. She is an emergency medicine and interactive medicine physician at the VA St. Louis Healthcare System in Missouri and an assistant professor in emergency medicine at Washington University School of Medicine. Previously has served for 3 years as the Whole Health System Clinical Director at the VA for St. Louis Healthcare System and 10 years as the National Whole Health Champion for the VHA. She is currently a member at large of the Board of Directors of the Academic Consortium for Integrative Medicine and Health. We have such an esteemed panel here to kick us off this morning. So I'm going to get us started on really talking about the importance of physical and mental wellness. So with that, to the panel, welcome. Let's talk about what is really in the importance of health. There continues to be a research on the effects of health in employees in the workplace and retention, burnout prevention, and job satisfaction. From your perspective, how does focusing on wellness continue to retaining clinical talent? And do you find any effects to quality of care? To the panel, who would like to start this morning?
Denise, I'm glad to jump in here because, I think it's an obvious answer to me about does it affect quality of care? Absolutely. We've seen that. And I would say that we're not 100% recovered from pandemic time because, we're all still working hard to improve those outcomes. But one of the things that I've gotten pretty clear on, and I think this kind of started with the work that I did in the National Academy of Medicine with the report that we wrote, is the fact that, individual improvement in well-being is very, very important. But individual improvement alone will not sustain well-being, and we have to change the work, which is really hard to do in some cases. And leaving the work where clinicians have high cognitive load, or some cases that spills into burden, that's a recipe right there for missed care and for errors and threats to patient safety. And I think those are some of the things that we really have to pay close attention to as we look for improvements.
Thank you, Dr. Pappas. Would any of the other panelists like to respond to the question this morning around wellness and how it contributes to talent and on the effects to quality of care?
Yeah, Denise, love to chime in. Really agree wholeheartedly with what Sharon has shared. In the Veterans Health Administration, as we looked at well-being, especially coming out of the COVID pandemic, to be quite honest, this really magnified a problem that we already knew we had to even greater heights. And as we looked at it, we had the same observations, right? That when we look at well-being, we have to look at it from an organizational level, from a team level, and from an individual level. And there are different interventions that happen at all of those levels. Completely agree that you can't do one without the other and expect to see culture change. And when we do see people who are committing to the organizational, team, and individual changes, we start to see movements in culture as we can measure on our all employees survey. And this, we even correlate this to job satisfaction and feeling like they want to stay in this organization. So those are promising trends that we've been seeing year after year. And what that means then is that directly impacts the experience of the patient, in our case, the veteran who's receiving care. Because we know from literature, right, that people who are burned out, who are feeling disillusioned, disengaged, that does impact quality of care, medical errors, and costs. And so I think subjectively, we are seeing that cultures that embrace this are having an improved experience for themselves and for the people they care for.
You know, as part of the efforts that we're doing, and I know all the panelists really have programs that they've either championed or they've implemented in their organizations currently. Could you share some of your antidotes or highlights on programs that you have found have been successful, or something potentially maybe you are currently implementing? Would love to hear more about those programs.
And I'm happy to start this conversation rolling. So I think this is a fitting conversation, especially for the symposium. So I'm really lucky and blessed to be here with each of you on the panel. So I can tell you that at Ingenovis Health, we partnered with a leading agency to conduct research about, what do clinicians really need to feel supported? How can we help, improve clinician safety? And so, those were the major pieces that got us to the ACT program. So I'm excited that we're here again. But when we did do the survey, we found that over 80% of clinicians voiced, or nurses, travel nurses voiced, that they really wanted it wasn't about just financial support or having those increased finances or making more money. It was about, having career tools, having tools to support their work-life integration and balance. And so that's what led us here today. It's really important to have that feedback and to continually put those positive resources to establish and foster wellness in front of them. So the ACT program is a really good example of that. And I think it's a really successful program so far.
Wonderful. Would anyone else on the panel like to respond to their programs potentially that they're using today?
Sure, I can jump in, and then I'm certain Courtnay and Sharon also have so much to share. So I'll just be brief, but very excited to share because we've been so committed to this for years. Two things. One is the whole health approach to care. This is the idea that we want to transform the way we're delivering healthcare to a system that's very much focused on empowering and equipping people to meet their health and well-being goals. In order to do that, we help employees experience whole health for themselves. So this whole health approach really extends opportunities for people to receive education and experiences in all of the domains of well-being, whether that be relationships, sleep, nutrition, movement, values, meaning, purpose. Meaning and purpose are really the central construct. And the behaviors that we want to focus on with folks are around mindfulness, gratitude, job crafting, social connectedness, and easing isolation, and self-compassion, for example. So evidence-based behaviors we know can help people in their well-being and don't necessarily require you to leave and go to a class for an extended period of time, because that's not really a possibility in the current environment.
Yeah, and
oh, go ahead.
I was to say, even at Ingenovis, we offer short sessions for our employees, 5 to 10 minute breaks during the day, and some of that is more reflectful. I'd love to hear what other organizations are doing, and if there's any innovative programs that you have as well, in addition to what Dr. Reedy has shared.
I'll go ahead and chime in, if that's okay, Dr.
Sure.
Pappas. No, thank you so much. And I love everything that I'm already inspired, and it's been 15 minutes into the symposium. So I think that some of the programs, in addition to what you'd shared, Dr. Reedy, that we've experienced here and then also in other organizations has been really clinician focused. I think starting with whatever way you might term it, shared leadership, the clinician voice, shared professional development, but listening to your people, like you said, through your surveys, whatever way you do it, and then actually acting on them. So it's ironic with the title of the ACT program with Ingenovis, because it does really think about, are we listening, but then are there things that we can apply and understand our clinicians where they're at today. The housing crisis and food insecurity are real things for some of the clinicians I've heard recently in some of our listening sessions. And so the organization trying to approach that in different ways and putting efforts there and listening to things that they can help control and help add value to. And then also leadership training has been really successful. I've seen and a different approach where leaders being able to ask the simple questions to their teams and looking for keywords or potential things in their life that may be leading them to not be the best that they can. And so helping them focus on why they're here and what they want to do and bringing the best care to the patients.
Yeah.
And I'd like to pick up on what Courtnay just said, because it's so important that we think about how we lead. And not just leading, from a management perspective, but leading from a relationship. And I think that that relational type leadership has really resonated with people, so that there's increased trust in the work environment. And it raises the chances that people are going to say, hey, I'm having trouble here, and be able to act on some next steps related to that. So, Courtnay, I'm glad you brought that up, because I wholly agree.
I'm curious as to, I know just being in healthcare, our clinicians put in long hours, really long hours. And I'm curious to see if you have any suggestions or advice on how organizations can support physical wellness of their staff, especially when they may be taking on long hours. Very interested to see if there's any innovative ways you're tackling that.
I'll kick that off, Denise, and just say that, this may seem a bit small to most folks that are listening in, but we formerly had a policy that said if you're caught sleeping, you will be fired. Sleeping at work, you'll be fired.
Mm-hmm.
And think about how that makes you feel just when you hear me say those words. And we had a group of employees who actually took that on, and we now have revised that policy that put some parameters around, what we call power naps, and what's acceptable during break times on night shift or during a long shift, that actually give people permission to take better care of themselves while they're in this intensive work environment.
Yeah, I love that. I love the rethinking of maybe standard policies in order to support employees. I think it's so important. Any
Sharon,
other?
Oh, no, I was just going to say that your previous question about what's keeping clinicians, that would make me want to work at that organization, hearing that as a night shift nurse. And so I think that those type of things and listening to what's important and being able to smash previously known norms, not death by policy, but listening to what makes sense and how people can be the best clinicians they can. And again, we're meeting them where they're at. And having space, allowing break space, respectful time away from work, where it can be in any role that people might be in. There was a chair massage rolling through, not just on Nurses Week, that I felt the clinicians, I saw them lining up and signing up for. And even if it's just a quick power thing, it is something that this isn't just the flavor of the month. And so they were sharing recently how much that meant to them, just to know that it's a staple in organizations for physical well-being. But like you said, I think it is the respect for time and proactively, where you can, allow for a respite away from the very important decisions clinicians are making all day. So
Absolutely.
I
And
agree with
in
that.
addition to the physical well-being, I'd love to hear some of the ideas around how we take care of the the emotional wellness and what organizations may be doing to address mental health, because that plays
Right.
an important role in total health. So what are the panel's ideas and inspirations around how do we address mental wealth or health in the organization?
Denise, I think I can start this one. I agree with Sharon and Courtnay, and I'd almost like to, I think this question rolls right into the other, where the biggest piece of really fostering that, physical and mental well-being is being, that example yourself if you're a leader. And that's really important. Another thing that I can recall at being at the bedside as a nurse is, we had all these resources, but then you would forget that those resources were available to you. So if you're going to fund those resources, you're going to put those resources out there for them, make sure that you remind them, constant reminders that those things are available to them. They're constantly busy, and rightly so. Patient care is top of mind. So we want to make sure that we're getting those reminders, whether it's podcasts or apps or webinars, putting those resources and emails back in front of them so that they understand that they are supported.
Wonderful.
Yeah, and I'll just add to that, Robin. I think this gets back to this idea of easing social isolation, right? Because a lot of what we're feeling is a shared experience. I'm a clinician myself. I practice in the emergency room still. There are hard moments that you need your peers to be able to have that chance to debrief and often let trauma go, so that you can mentally be strong. So I think that social connectedness is a big deal. One thing I do want to add, though, is, addressing inefficiencies that burden the clinician is really the priority. We do a lot of non-direct patient care work, right? And so what we can do is listen to teams, sort through those pebbles in the shoe, and then empower them to de-implement some of those inefficiencies. But that takes strong leadership to support those teams doing that. And then that can ease some of the mental burden as well.
Yeah, thank you for that. And two things that I think are very important there is always looking at how do we clear roadblocks and how do we help people really do what they've trained to do, and that's provide the best care at the bedside. Very, very important. And the other point that you touched upon was being connected and being part of a bigger purpose. And I know at Ingenovis, we always focus at creating a home for healthcare professionals. So I would love to hear what your organizations are doing to really encourage that connection with your teams, the social connection that's part of the total wellness as well.
I think probably from close after as the pandemic began to send us fewer patients, we really ramped up what we call our peer support. And we actually put some programming around helping prepare people to be in a support role. And you see a lot of the literature on this that was when it was started, it was about the second victim to a bad patient outcome. And now it more has morphed into peer support for whatever the peer needs you to support. And so we felt like that needed some structure around it, and we've done some pretty extensive training that puts a lot more people on the ground, so to speak, that are available just in drive-by situations, and so that it's not too heavily formalized that it becomes scary to people, and they're more prone to access that kind of support. I think the other finding is that many times that peer support is equally provided by people who have strong family units or social networks, but not everybody has that. And so we felt like that this was a good way to support that for those individuals who maybe needed it more than others. So that was one thing we did.
That's awesome. Any other programs or efforts that you're implementing on this?
Dr. Pappas, I love the way that you shared that peer support. We were just talking as we had here at Cottage had a burnout committee, and the team said, that sounds so negative. Let's make it a well-being committee. And so they have had a small group, and they're such great grassroots, leaders, some clinicians, some leaders that are passionate about this, kind of in a needs assessment, asking like the why. And one of the questions was, do we have any space where we can just chat and talk? And having, and so from a leadership perspective, what a great privilege it is just to create that space and allow that time and encourage that. And like you shared, clinician to clinician, people will kind of gravitate to their groups that they work with, but sometimes they don't want to talk to that group and just need the space. So that's been a great relaunch. And from a leadership perspective, the managers saying, how do I talk to my people if they come to me? How do I help support this? And being able back to developing our leaders as well to do that, not only with their teams and their peers and making it okay, but also being able to encourage that from their teams as they support their ability to connect with each other on whatever level and whatever way might be needed. And they've all launched as their own personal goals and unit-based goals to have peer support groups and mentorship groups in whatever way they might want to call it, but they have a person and a group. So that's been very rewarding to see grow. So I'm curious if anybody else has programs like that as well.
Yeah, Courtnay, I'll share that. I love the comments about leadership. I think we really see the frontline managers as a key population that we need to address. They're force multipliers, right? Because we can think it from an executive level, and you can want it from a ground level. But if your managers and supervisors aren't able to help create that environment or culture, sometimes it stalls. So we really focus there, and we have a workshop called Taking Time to Care. It's a day allowing some debrief of what am I feeling, what am I dealing with, what are the pressures, and then moving into what are some tools and resources to build resiliency for me and for my teams. So something similar.
Interesting. And are you seeing any trends or as you're looking out, a year from now or 2 years from now, are you seeing integration of wellness into healthcare settings more so than we have today? I'd love to hear, what trends you may be seeing or what you're working to continually bring to your teams as part of wellness.
I'd be happy to start this one. I can tell you from our Chief Nurse Advisory Council or our board, we hear frequently, and Courtnay is a part of that council, so thank you so much. But we hear from other health systems what they're doing to, foster wellness, and value and belonging is one of those that top to mind of something that we do internally with Denise's team, and we love that. But we also we see that there are more mentorship programs that are multifaceted. Maybe they're leadership based mentorship programs, or they could be just peer-to-peer mentorship support programs that are really helpful throughout those different health systems. Also find that, they actually have wellness rooms. They're continuing to build those wellness rooms or respite rooms where if they have a few minutes that they can pull away from patient care, they can go and recenter and just, gather their thoughts, especially if they've just dealt with something traumatic. And often there's a lot of loss that's involved in patient care at the bedside. So it's really helpful to hear from those other health systems that they're very much aligned and they're continuing to really put wellness and belonging and well-being at front and center.
Thanks, Robin. Anyone else want to join in?
Robin, I just shared I was just wanting to say that I shared I recently was at a conference and saw Joanne Romero presented on using VI for her clinicians in the critical care to decompress after a stressful situation. So I thought it was amazing and want to adopt it immediately. But the clinicians who were able to give that break right after a critical event or just in a very difficult shift, and then see how it impacted them. She was sharing how well it's been impacting her team. And I thought that was a really innovative thing I heard recently. And I know we like to share best practices with each other. So that was something really neat, interesting.
I can add to this too. I'm just sitting here reflecting. It's such an ongoing process. We have so much work to do. And, sometimes it can be fragile. You can build it up and you think it's integrated, but then a system pressure comes and it can not be sustainable. So when you ask about trends, Denise, I'm thinking about where it's integrated into team meetings and huddles, where there's constant process improvement and asking about how do we decrease administrative burdens, where there's a focus on professional development and growth of the clinicians and the leaders. This is where we see those promising trends. but it takes constant nurturing. I really think that's the word, you know, to keep it sustainable.
Yeah. And I know this panel is very focused on, taking care of clinicians. I've had the opportunity to work with some of you directly, and I'd love to hear from your perspective, are there certain programs or resources that you think your nurses in particular have found beneficial? I know uh, that has always been the first and foremost for those on this call. So I'd love to hear more on your insights of what you've learned from your nursing teams.
Well, you heard me mention earlier this thing about cognitive burden. It's very real, particularly in busy inpatient units, but it could be anywhere. And that's when the amount of information nurses have to retain in their heads as they take care of patients is really something that adds stress to everything they're doing. If they feel like that things are falling off of those stacks of either tasks or just things they have to remember to do. And so, we're trying to look at how does our electronic health record and other technologies, how can that help reduce that cognitive load? And one of the things I just love this because it's I'm clinically I practiced in emergency nursing and in some critical care settings, and so when I think about the fact that we now have rapid response teams that can use the data in our electronic health record in order to determine when a patient is going to deteriorate, and they respond based on that, as opposed to waiting till they do deteriorate and have a code or require a rapid response. And what that has done to kind of lighten the load on clinical nurses at the unit level that knows that someone else is watching and helping. We're in the process of deploying over 2,000 cameras into our acute care rooms. Won't be done until 2026, but the first 1,000 are going up this year. And thinking about all the ways that we can use those cameras in order to be that second set of eyes and a care partner with nurses, taking away some of the low value tasks that they have to do so that they can really focus on using their knowledge in order to take the best care of patients that they can. What I know about nurses, and, from having been one for so long, is that it's not hard work that burns us out. It's feeling like you haven't done a good job on behalf of your patients. And that's probably true for my medical colleagues as well. And so, I really do think that when we ask ourselves, oh, somebody looks like they're really busy, maybe that's not the perfect indicator, but when someone truly feels they've done a good job, that is such a soothing, purpose-driven objective that I think we should look for more ways to make sure people are feeling that way about their work.
Yeah, the power of acknowledgement and helping people be successful and feel that way is pretty amazing of what it can do, what it can bring.
Yeah.
As we're getting, I know we're getting close to the first wrapping up the panel. I'd love to hear any final remarks or ideas that you may want to share with our audience about wellness and really how it does impact retention. And again, so grateful for all of your participation today.
I mean, I can jump in with a thought here because, we live this every day where you're in an environment where you don't feel like your well-being is supported, despite the fact that we are all very resilient people, right? We all have learned a lot of these coping mechanisms over time. So what I just want to say is that, when you feel that urge to be disengaged, the actual treatment, so to speak, to feeling disillusioned or burned out or unwell is to become more engaged. And so how can we get people really becoming a part of the solution, identifying the inefficiencies, speaking up when they see something not going well, supporting the mental health of their friends and colleagues. That's really the message we want. Don't turn away, turn in, and see how we can do this together.
I love that. I love that. Any other remarks from our panel on ideas on retention among your nursing staff, or what you have planned for the future for your teams?
I'll just briefly tag on to what Dr. Reedy shared. I love that turn in. It's going to be a sticky
Yeah.
to look at. And it is the message, and back to kind of what we were sharing about easing the burden of the teams. As a former informaticist, the IT perspective and not giving somebody another task to do to tell the story, but helping them tell the story through technology, I think is one of the most exciting things that we're seeing now, and asking what makes sense, not just assuming this would help them with their patients to allow more time at the bedside. The clinicians have shared, I just wish I had a little bit more time, and that makes me feel better as a person. So how we focus everything that we do, not having a meeting about it, but having an actual, let's walk and see and talk to them from hearing from their voices. So I think, like you shared, sharing the best things that are out there with them, and reminding them on a daily basis what is available, and having that peer support, and at the leadership level, role modeling is really important, and not having the badge of honor of working so many hours, but showing them how we can help protect our time and respect them as well, and give them the life that they have outside of work to be the best they are here, but really keeping it as ingrained as possible, and checking back in with people when they may not ask for it. So it's a great start to thoughts, and love to hear more from others as well.
I would agree with Courtnay and Kavitha. I think one that sticks in my mind is just, taking care of each other. And, there's always programs for clinicians and employees, but I think the leaders forget that those same programs apply to them. And, we all need grace. We need to allow others to learn their job, and to, allow people to make mistakes and help them through the mistakes when possible, and make sure that it's not a punitive thing. I think that recognition of, how challenging times are is important, and having that empathy is also important.
Thanks, Robin. Dr. Pappas, any closing remarks from yourself?
I will just say that I loved what everybody had to say, and I've taken something away from everyone. So I think the message in that is, don't stop learning. Develop your own internal expertise around this, and develop a mindset that I think will really take you further in exploring, what's most important. I think about the fact that we do employee surveys, a couple of times a year. We have professional governance that's very vibrant and gives you pathways there. But, ask yourself, am I reaching every employee population? And are there things I need to hear just from having that interaction? So Courtnay, I love it. Get out there and look and listen and interact with people, because it's through those relationships that I think we heal, and I think that we understand each other better and understand what's important and what really matters.
Thank you, Dr. Pappas. And again, I want to thank all of our panelists this morning. I agree. There's been a lot of key learnings. And as much as we're doing with technology, we all come back to the importance of each other and people, and leaning in so that we can make this happen together. So very, very thoughtful insights this morning. I again, thank you all panelists. One thing I do want to point out, I know we are getting some questions, and we want to make sure that folks in the audience are directing those to our Q&A today. We are going to be able to respond to those, maybe not during the panel, but after this session, we will definitely, through our ACT website, be able to address some of the questions being asked. We're going to take a quick break before we dive into our next session, which is a candid CNO conversation about physical and mental health. So again, thank you everyone for this kickoff this morning. Really appreciate everyone being here, and we'll pause and come back in a short few minutes. Thank you.